Thank you very much, Jeff. Good morning, everyone. And thank you, Patty, Jerry, and everyone in the organizing committee of this conference for the invitation. It's a pleasure to be back at City Health International. To address the question, is public health in crisis, I will, of course, as you may expect, focus on global health rather than public health, but I believe global health is global public health, and Julio Frank defines global health as public health. I will look at global health, of course, also with a bias towards HIV/AIDS, because that's where my experience is. And the points I'd like to make is to look at how global health is affected, has been affected, and impacted by a changing environment, a changing globalization in the last 10, 15 years. And the answer to the question, Jeff, to me, is that yes, global health and more generally global public goods are in crisis, including and maybe starting with global health governance. And the way forward, it can only be political, with a question that I'm actually putting to all of you. Can the SDGs, the Sustainable Development Goals, mobilize increased action around global health? Now, global health is a concept that started a little before and around the 2000s and the conception of the Millennium Development Goals. At that time, if you remember, geopolitics were simple. There was a rich world and a developing world. There was what we used to call a global north and a global south. There was a hope for a globalization that would open markets, and by providing opportunities to everyone, sort of build an interdependent world that would have positive consequences for everyone. This was also a time when, after a long period of time in the 70s, 80s, early 90s, where people were focusing on economic development and thinking that health could come as a natural consequence of economic development, that is, develop first and health will come second, people understood, particularly with the AIDS crisis, of course, that in fact you cannot develop with people who are not healthy, and therefore that health, rather than being a consequence of development, should be considered as a priority and necessary investment for development. That really pushed health on the forefront, and health came soon after, end of the very last years of the 90s, as one of the key global public goods. That is also the time where this concept of global public goods was being developed. And to illustrate what a global public good are, that is a good that one cannot develop, one country, how mighty it may be, cannot develop on its own. I'm using this beautiful quote, I think, from Kofi Annan. It's not beyond the powers of political volition to tip the scales towards more secure peace, greater economic well-being, social justice, and environmental sustainability, but no country can achieve these global public goods on its own, and neither can the global marketplace. Neither can the global marketplace. I'll come back to that. Thus, our efforts must now focus on the missing term of the equation, global public goods. And that's how 3 of the 8 Millennium Development Goals were about health, and how, if I remember well, 37% or so of the indicators, as we followed up on the MDGs, were related to health. I said earlier that I'll be often using HIV/AIDS as an illustration of the points I'd like to make. And one of the reasons for that, of course, is that HIV/AIDS has been at the forefront of advancing global health and in delivering on global public goods. Every one of you is well aware of the successes that the HIV/AIDS movement has achieved in the last 15 years. You can see in red the increase in the number of people accessing antiretroviral treatment, now over 17.5 million, and as a mirror image to the increase in uptake of ART, the decrease in incidence and decrease in AIDS-related, of HIV infections and decrease in AIDS-related mortality. However, the however is important, progress remains unequal around the world. AIDS remains a global public health threat, 2 million infections annually. A large proportion of infected people remains undiagnosed, 1 in 2 at least not on treatment, and many people remain highly affected, particularly affected by HIV. The epidemic tends to be concentrating among young women and young girls in the African continent, MSM, sex workers, people who inject drugs globally. There are signs of complacency. I'll discuss that in more detail. Setbacks, weaker activism, declining political commitment, stagnating resources. And I would like to discuss how that relates to a changing global context and a changing, what I would call a changing strategic relevance of health in the global arena. One more slide on AIDS, and that slide may be familiar to a number of you. This slide indicates from UNAIDS that if we continue fighting AIDS in terms of prevention and access to treatment at the same pace as we have been doing in the last 10 years, despite our successes, what you'll see happening is what is depicted here in red, more infections than actually people, lives saved from treatment and infections prevented, and the AIDS epidemic taking over again. If, however, the world is to truly intensify its effort and accelerate, then we could achieve a sort of blue scenario. The question is the world ready for that in a changing context? Now, here are a few features of this, let me call a new context of globalization and a new context of global health and of the interface between global health and globalization. The demographics are changing. The social and economic demographics are changing. The world is urbanizing, and this is not the audience that would need to be convinced about it. That we see new patterns of inequities. We see new economic powers and shifts in economic power. We see multipolar rather than bipolar geopolitics. We see a world that is more and more governed by commercialization. And we see a world that paradoxically, however, somehow is more connected than ever, and at the same time, everyone moving to individualism and nationalism. I think a very striking paradox. Again, I'll come back to this. In terms of new economic demographics, some of you may have seen me showing this slide, which is how the world was in year 2000. In red, the low-income countries. In light blue, the lower middle income countries, in dark blue upper middle income countries, and in green high income countries. This is the World Bank classification. And this is how the world will look in 2020, just 4 years from now. And that is, of course, that shift is, of course, a major shift. So people may say, here we are, globalization successful, GDP increasing everywhere. The answer is, in fact, yes, GDP is increasing, but people who are rich remain richer and actually have become even richer, and the poor people have remained and will remain poor or even will become poorer. Here is an illustration of this. This is South Africa, and what you can see in red is the increase in GDP in South Africa between the years 2000 and 2011 in 10 years' time. And what you can see in orange is the proportion of the wealth, of national wealth, that is owned by the 20% richest in the country. And in purple, the percent that is owned by the 20% poorest. And as you can see, these proportions haven't changed, which means that as the GDP grew almost exponentially in these 10 years, the richest have become much more rich, and the poorest have remained poor and have not benefited from that, from what you could conceive as could have been a redistribution of the wealth. This new pattern of inequities, where inequities are no more as much in between countries or between the North and the South as they are now within countries, and particularly within the emerging economies, and within these countries that, as I've shown you before, are switching from the red or blue color to the darker blue or green color, is now impacting on health. This is a paper published in PLOS Medicine not long ago, and where you're sitting from, you can't read the conclusion, but I'll read it for you. It's a paper about under 5 mortality and about the gap that we need to close in under 5 mortality. And the conclusion is that under 5 mortality disparities within developing countries, accounts for roughly half of the global gap between developed and developing countries. Thus, the authors say, within country inequities deserve as much consideration as do inequalities between the world's developing and developed regions. So the new pattern of inequities at country level, particularly in emerging economies, strongly impacting on health. And I really think for those of you who focus much more their work on and their attention to cities and local public health, I hope that there are some sort of lessons that from global health that can resonate here. And one other illustration, I believe, of that is that as these within-country inequities grow, the AIDS epidemic tends to concentrate, as I said earlier, and here are some of the figures. People who inject drugs, 24 to 36 times at higher risk of acquiring HIV than the average population. Transgender women, 21 to 49 times. Men having sex with men, 17 to 24. Female sex workers, 10 times. And the prevalence of HIV among inmates, 6 times higher than in the general population. Let me just dwell a little more. So I sort of talked very briefly about new demographics, new patterns of inequities, new economic powers. I don't need to expand. These shifts are very clear to all of us. So are multipolar geopolitics. Again, there is no more a rich world and a poor world. There is no more a rich West, somehow West plus Australia, Jeff, and a developing world. There is a multipolar world. There is Europe, and actually a fragmenting Europe. There is North America, there's Latin America, there's Africa, there's China, there's India, and there is the Russia and Eurasian environment. A very different geopolitical context than in the year 2000s. Let me just stay a few minutes on commercialization, virtual connectedness, and individualism. To go back to very basic things about equity, equality, and solidarity. What has changed is that, contrary to what we have seen from the end of the 19th century to maybe the beginning of the 80th, which was a decrease in economic inequities, since the beginning of the 80s, actually economic inequities have been growing, and the share of wealth of the richest has continuously increased. And all of you know these figures. In my country, France, 1% of the population owns 20% of the wealth, and the 10% richest own 40% of the wealth. And these figures in the United States of America become almost ridiculous, where it's 0.01% of the people that would own more than 20% of the wealth. And there are many social, environmental factors and economic factors to this. I believe the failure of the actually open market to deliver on what it was originally aiming at. But one contributing factor from a more, let's say, philosophical sort of perspective is, I think, a breakdown in the very concept of social equity or social equality. And as we were losing the profound meaning of what we wanted to achieve in democratic societies in terms of equality and equity, we've been delegitimizing taxes, we've been delegitimizing the idea of redistribution of wealth. And it's interesting to remember, saying this in the Kingdom of England, that in the founding principles of the French and American revolutions, equity was considered as a qualitative indicator of democracy, not just a measurement of how wealth is distributed. And I believe at times where the world is really losing hope for a society of equals and the perspective of a global common world, it's time to rethink about this and rethink of how we restore this concept, and leave out only focusing on economic inequities as maybe Amartya Sen and others have done, as the lens through which we delineate between legitimate and non-legitimate inequities. I believe equality and equities are as much a political and social concepts as they are economic concepts. And currently what we see in societies is that rather than willing to have a society of equals, of similars, if I may say so, evenness, that was the dream of the socialist revolution. The current expectation is that really equality among everyone is recognized also through recognizing people's differences. Now, what is interesting and strange to me, just as we're very connected and yet very individual, we're all unhappy about the world as it is. We're all saying it's unequal, it's unjust, and at the same time we do not act, or we even somehow accept and legitimize the very mechanisms that generate those inequities. We love the concept of merit, of the American dream, of the competition, and somehow people are passive. Although they feel the world is unjust, there is resistance to change. And a French historian, Pierre Rosan-Vallon, here mentioned a French philosopher of just before the movement of the pre-revolution movement of the early 18th century, Bossuet, who was saying, God smiles at people who complain about the consequences while they cherish the causes. So I see this very much how people consider the unjust world. And so these are also times not only where we've lost, I think, how we don't have a positive view of what we would like to achieve in terms of equality and equity. And at the same time, we're also asking ourselves whether there is an international community. We keep talking about the international community. It should do this, it should do that. But is there an international community? At a time when many people actually question whether what we call the universal values, but that's really have been generated in the West, are truly universal. When we question global governance, we're now returning to nationalism and to real politics rather than to global governance. We are questioning the potential of the global market economy for that win-win that it was hoping for, because what it has achieved is, in fact, a rise in inequities. And indeed, we question whether our interdependence, which we thought would build a common and more equal globalized world, is really achieving a common world. The world is more a kaleidoscope than it has ever been. So is it actually possible to look at the global governance and the global governance in health in a world where there's no international community? I don't think the UN at this time and the intergovernmental system can answer that question at a time when the civil society and the community, and Susie, I'm sure, will address that, is actually part of the decision-making and the governance, and where the multilateralism is failing, at a time when I think in the next few years we'll continue to see a very unsteady global system, where the question may be, and the hope may be perhaps, in the ecologic emergency as the future trigger for building an international community and the global economy and governance. So that was the sort of what I wanted to say about the global context, globalization. A few words on the changing strategic relevance of health in that world. Well, the international and national resources have been decreasing as a result of the economic and financial crisis of the 2010s. We see less political mobilization, clearly, around global health and global solidarity, less debate around global public goods, an uneven commitment to multilateralism, even though the replenishment of the Global Fund went relatively well, which is great news. And to me, one of these examples, the clearest example of that failure of multilateralism, or even of the new forms of multilateralism involving the civil society, some multilateralism or new multilateralism that pedantic academics call polylateralism, is the lack of significant progress of a framework on intellectual property right. Now, health. Health remains obviously a major contributor to development for people, but it has also now moved, interestingly, and maybe that's its chance, to the political transnational agenda, and certainly to the economic and commercial transnational agenda. Health is now high on the security agenda, driven by the fear of global pandemics. It's strong on the foreign policy agenda. It's strong, of course, on the economic agenda, which sees the health sectors as a 6.5 trillion global growth industry. It's strong, good for it, that is still on the social justice agenda. And it's now an integral part of what one can call the interdependent global crisis agenda, including environment. But if you think of it, many of the issues that impact on our health are no more in the hands of the health sector. Inequity, social determinants of health, social protection, universal access to health systems are really with ministries of social affairs, not ministries of health. Environment is outside our area, although it impacts. Global lifestyles and non-communicable diseases are really out of hand of ministers of health, and diseases of poverty also. So if you think of some of the major political challenges that global health is now facing, the first, I would list the increasing political nature of global health agendas. And that's true at the global level, at the national level, at the local level. The power of global industries. As I put here on the slide, a significant part of the future of global health is decided in boardrooms, not in ministries of health. The clash of norms and ideologies. I mean, the fact that opioid substitute therapy was interrupted in Crimea within 4 weeks after the annexation by Russia is really a sign of ideologies now dominating. The rise of nationalism in the face, again, we're in a more and more interdependent world, and paradoxically turn to nationalism. And the use of health as a political tool, again, OST and Crimea. So as we look at how to address these challenges, we should realize that more and more of these challenges require the interface of governance domains, not just health. They require an understanding of the changing environment in which we are, and they require the cooperation of many actors, public, private, civil society, based on shared principles. And whatever I'm saying at the global level is, I believe, true at the national and at the local level. And that's also one of the key issues. And let me just end by discussing a bit governance. And let's just ask ourselves, is the multilateralism actually failing in global health governance? Are the institutions we have ready to act in view of this global structural vulnerability that I've been described? And what can be the role of SDGs in mobilized increased action around global health? Now, interestingly, if you look at the last 3 crises, I could have added H5N1, of course. There's an interesting political commonality here. All 3 have been driven forward by taking them to the UN at the end, and actually from the UN in Geneva to the UN in New York. There was an important role of G7 for AIDS, G20 for the others. They've been pushed. There was a push through the MDGs for HIV. There's a potential issue of whether the SDGs will push us forward. All 3 have health security dimensions. All 3 are linked to governance challenges around research and development, IP, and all 3 have also been strongly driven by non-governmental actors from civil society and community. So as we think of framing global health governance, we have to think of leadership, and the leadership issue emerged clearly in these 3 crises, whether it's about successes or failures. We have to increasingly think about conceptualizing governance of health around an interface of health, security, macroeconomics, and development policies. And we also have to think global and national. I think just as the role of a diplomat used to be to protect his or her country's interests, the role of a diplomat now is to defend his country's interests, but also to build a better globalized world. And so is the function of a Minister of Health. It is to take care of the health of his citizens, but also to build a more healthy global world. We do have to manage these challenges. We have to negotiate the political choice for health in the face of other interests. We have to manage relationships between the various actors. We have to build the right alliances for health outcomes. We have to contribute to health security, and we have to keep in mind as a driving force that we want to support human rights, reduce poverty, increase equity. And I think in health, or in health diplomacy, we have two strengths. One is the science. We have an evidence base for what we argue about and argue for, and then we have a value base, which is health equity and human rights issue. So I believe politicians and electorates need to accept that in a global world, we now have both national and global interests, and governments must be held accountable for both. So in times of individualism, in times of fragmentation, whatever happens at the local level, at the city level, at the national level, cannot be dealt with without actually also trying to contribute to build a globalized world. And we in the health domain can't just, be content with just setting a set of priorities. We need more money for AIDS, we need more attention to non-communicable diseases, but we really have to think beyond health and embrace a broader notion of sustainable development. And remember that health is a political choice at all levels of governments. Health is politics. Thank you.
Thank you very